Hello everyone, my name is Brandy Kersey and today I would like to tell you a little bit about medical assisting. Today I would like to tell you about the schooling involved, who we actually are and what we do, and the certification and continuing education part of this career. The schooling involved with medical assisting takes about 12 months in most cases. Sometimes this can vary across the U.S., but it usually is done at a technical college. The schooling involves basic pharmacology, basic anatomy and physiology, basic clinical terminology, medical terminology. You learn how to do procedures such as giving shots, drawing up the medication for these shots, how to draw blood, how to do basic vital signs such as taking a blood pressure and temperature, height, weight. You also learn how to do more hands-on procedures such as removing sutures, how to assist the physician in basic surgical settings such as possibly even removing skin cancers. Also involved in the schooling is learning how to do basic computer skills and clerical skills. You learn how to call insurance companies and get certain procedures approved. These procedures can be types of nerve studies, MRIs, CT scans, just various types of tests that are available in the medical field. You also learn how to do billing and coding, your basic telephone skills. You learn how to interact with the patient. The U.S. News reported in 2012 that the medical assistant is a very diverse mix. This makes us very versatile and a huge asset to a medical office. After the schooling process, right before it's over actually, you usually do about a 6-month rotation period that sometimes can go between 1 to 3 medical offices. You meet various doctors, medical staff. You learn very much of a hands-on experience. I feel this is the most important part of schooling, is the hands-on experience. You shadow other medical assistants and sometimes nurses. You meet all kinds of people, and I think this is just extremely important before you get thrown out into the job. After the schooling process is over, you are able to get certified through the AAMA, which is the American Association of Medical Assisting. They have actually estimated that the medical assisting career is expected to grow 34% by 2018. This is huge. This is probably the fastest growing of all the medical careers. Some people that have even had trouble finding jobs in other medical things such as ultrasound, x-ray, they have came back and got a medical assisting title on top of their x-ray or ultrasound, which makes them very versatile. So the good thing about medical assisting is it does kind of give you a background in case you do decide to go up the ladder as far as maybe going back to get your RN or PA, which is a physician's assistant title. You have some basic knowledge under your belt, so you're not totally new to any of the information. The certification process after the schooling does involve some extra work. You have to usually go and take a test the first time. After you pass the test, which is about 200 questions roughly, you have this certification title. This allows you to call yourself a certified medical assistant. You do not call yourself a nurse. Most patients or friends, family often kind of confuse this, but this is not our title. This is what we're supposed to be called, as a medical assistant. After you get that, you are able to do what they call continuing education that provides you more knowledge. You have to take short little quizzes based on some articles that you can either get online through the AAMA, or you can order these separate through different companies. These are actually very informative. They're very fun to do. They're not boring at all. It just furthers your knowledge as the medical assistant, allows you to know more, and some of this knowledge you can actually use in the office, in the setting with your patient. Might be something you didn't know. Sometimes you can even share this with your doctor. It may be something he didn't know. A lot of times they're just clinical studies, just providing the information that is out there. that being certified is actually very important. Not all employers require you to do this. Some will actually not hire you if you are not certified. However, it does look extremely good on your resume. It does look good to other employers, and some doctors will even require that their office not hire anybody that is not certified. The Seattle Times actually wrote an article about this about 6 months ago. So that is what a medical assistant is. If anybody has any questions, feel free to post here on the board. But thank you for listening to me today, and I hope everybody learned something interesting about this particular career. Thank you.